Hi, I'm Janine, a former case manager.
And I'm Truck, a former social worker.
We are currently psychiatric nurses, but we remember what it's like to work in community mental health without a background in neurobiology or pharmacology.
Our goal is to help case managers and social workers better understand what their clients are experiencing so that they can feel competent and confident that they can meet the needs of their local community mental health clients.
The module discusses the neurobiology and treatment of anxiety. Before we begin, we believe that you'll have the best learning experience by downloading the guided note sheet to help you follow along with this presentation. The link to download this is just below. All right, let's get started.
First of all, it's important to understand that the experience of anxiety in a dangerous situation is a normal adaptive survival mechanism. Increased alertness, heart rate, blood pressure, and breathing ensures a quick escape from predators. However, excessive anxiety in the absence of a threat is considered to be problematic. Core symptoms of anxiety are excessive fear and uncontrollable worry. Anxiety can also cause people to feel fatigued, on edge, or irritable. They have trouble concentrating or sleeping. Anxiety disorders often occurs in individuals who have other mental health issues, especially depression.
There are multiple factors which influence the development of anxiety disorders. People may be born with genes which cause neurotransmitters, our brain's chemical messengers, to stick around too long after the message is sent. Genes can also impact how quickly the brain repackages neurotransmitters to send more messages. Pregnant women who are very stressed have high levels of the stress hormone cortisol in their blood, which can cause changes in the brain development of their baby. Stressful early childhood experiences can also cause permanent brain changes. Some of these changes reduce nutrition systems that feed the brain, making neurons less healthy. All of these factors make it more likely that an individual will experience problematic anxiety as a child or as an adult.
Anxiety symptoms are generally a result of circuits which are malfunctioning, a worry circuit and a fear circuit. The worry circuit loops between the prefrontal cortex in the front of the brain and the middle of the brain and back again. The severity of a threat is assessed initially in the prefrontal cortex. The threat assessment then travels to the middle of the brain, where it combines with sensory information and is interpreted. The message is then sent back to the prefrontal cortex to make a decision about a behavioral response. If this circuit is not functioning correctly, worries keep looping and action is difficult.
The fear circuit is centered in the amygdala, which quickly takes in information about the current situation and tries to match it with fearful memories. If there's a match, the amygdala starts the fight or flight response. Hormones, including cortisol, are released during this response to help people deal with the threat quickly. Genetics, trauma, or environmental threats can make the amygdala more likely to see situations as threatening and keep the fear circuit active.
Pharmacological treatment of anxiety disorders varies based on the type of anxiety. We will now discuss the most common treatments.
The most common treatment for anxiety are medications which regulate serotonin, which is a key neurotransmitter in the fear and worry loops previously discussed. Selective serotonin reuptake inhibitors, also called SSRIs, and serotonin norepinephrine reuptake inhibitors, SNRIs, are often referred to as antidepressants, but they also help decrease anxiety. Please see our module on depression to learn more about how SSRIs and SNRIs work and for discussion regarding side effects. Note that one possible side effect of these medications is a time-limited increase in anxiety while the brain adjusts to the medication. It may take 1 to 3 weeks for the side effect to go away. SSRIs and SNRIs generally take 4 to 6 weeks to become effective.
Often, when people think of anxiety treatments, they think of a class of drugs called benzodiazepines or benzos. Drugs in this class include Xanax, Klonopin, Ativan, and Valium. Benzodiazepines affect neurotransmitters by slowing down the brain signaling system. The net result is a reduction of messages in the fear and worry loops and a decrease in the experience of anxiety. The anti-anxiety effects of benzodiazepines are usually felt within 15 to 30 minutes of administration and differ in length of time they are effective. Common side effects of benzos include sedation, delirium, or unsteadiness on your feet. New studies are showing that the side effects of long-term use of benzos is an increased risk for dementia, so limiting the length of time that they are used is a good idea.
These drugs have a high potential for misuse or diversion. While these medications are known to be very effective in reducing anxiety, a few things should be kept in mind. Benzodiazepines should be used strictly according to their prescription. An increase in use without provider supervision is more likely to lead to tolerance of the drug and physical dependence. If dependence or tolerance develops, the person is at an increased seizure risk if they abruptly stop taking the medication. They should be medically supervised while gradually decreasing their use of the medication. Benzodiazepines have an additive effect with alcohol. This means that taking benzodiazepines increases the depressant effects of alcohol in the body. This is a serious safety issue which should be avoided.
Two other medications which are in their own classes are buspirone or Buspar and hydroxyzine or Vistaril. Buspirone makes sure that there is not too much or too little activity in the serotonin pathways. It functions similarly to SSRIs and SNRIs in that it needs to be taken daily and can take up to 2 to 4 weeks to become effective. It does not have the addictive or euphoric qualities of benzodiazepines and is generally well tolerated as far as side effects go.
Hydroxyzine is an antihistamine, like Benadryl, which has multiple medical uses. It is approved for use as an anxiety medication and is often used as a supplement for patients who are starting an SSRI or SNRI. It usually takes 15 to 30 minutes before it's effective. Hydroxyzine is not addictive or dependence-forming, and the main side effects include dry mouth and sedation.
Non-pharmacological treatment for anxiety disorders which have been proven to be effective include cognitive behavioral therapy and psychodynamic or supportive therapy. Exercise can also provide relief.
Thank you for watching our module on anxiety, created as part of a Masters of Nursing scholarly project through Seattle University. Please check our other modules on bipolar disorder, depression, ADHD, and psychosis and schizophrenia. Thanks again.